protecting your skin from the sun. Our conversation with Dr. Howard Brooks of Howard University. Your phone calls. Holiday weekend upon us. We're entering that time of year when we're all going to be spending more time outdoors. Our next guest has some advice that you'd be smart to heed. Dr. Howard Brooks is an associate professor of dermatology at Howard University. He's also a dermatologist in private practice in Georgetown. Welcome. It's good to see you.
Well, thank you for having me.
This is Skin Cancer Awareness Month, and I'm assuming that the timing, May, is for a reason we're at that cusp of summer.
Right. And that's true. This is the holiday weekend when everybody's heading to the beach. People are thinking about wearing sunscreen during that time, but it really should be applied every single day.
Every single day, all year round?
I tell all my patients that come in, I have a lot of cosmetic patients that come. They ask me what creams I can buy to get rid of the wrinkles, what can I do to get rid of the wrinkles, Botox, Fraxel, that sort of thing. I tell everyone sunscreen, whether it's an 80-degree day in May, whether it's 40-degree in April when it's raining or it's snowing.
Now, to some people, that's going to seem like just overkill, almost nervous Nelly kind of approach to skin. Why is that your advice?
And you have to be realistic. I mean, I tell patients not to tan, but you have to be realistic. And I tell them, I don't want you to not have fun. I don't want you not to go to the beach. But it's important to protect yourself. I always say to everyone, think of it just like you're brushing your teeth in the morning. A lot of us use moisturizers. Even most men use moisturizers now. So pick one up with an SPF in it.
When I was a kid, I think when you were probably a kid too, the sunscreens had numbers like 2 and 4.
Right.
And if you were really feeling like you wanted to be cautious and conservative, you might put on the 8. You don't see those numbers anymore. We've really taken skin protection to a really dramatically new level.
That is true, Bruce. That is true. And even my patients that have children, they're protecting their children from the sun. The AAD recommends that you use an SPF 15 or above on a daily basis. 15. And
we're seeing bigger numbers too. We're seeing 30, 45, 50.
Correct. I wear SPF 30 every day, and I have pigment in my skin already.
Talk about what we need if we're going to be spending intense periods of time. When do you ratchet the number up?
Well, I tell patients if they're going to go out during the day, you want to apply the sunscreen on approximately 20 to 30 minutes before you go out and reapply every 2 hours unless there's strenuous exercise. Now that does seem a little bit excessive, and I have to be realistic and realize that patients may not follow that exact direction, but it's important to reapply and be aware. Make sure you don't forget the back of the neck, around the ears, your nose.
So when you say put it on 30 minutes ahead of time, does it take a while for the protection to sink in? In other words, if you put skin lotion on, sunscreen on, and rush out the door, are you vulnerable for a period of time?
You are vulnerable for about 10 to 15 minutes, correct. You are vulnerable. It does take a little bit of time for the SPF factor or the sun protection to kick in.
Who's most at risk for skin cancer?
All of us are most at risk. They say that you should start sunscreen and sun protection early on because the damage that occurs during the first years of life when you're a toddler, when you're a child, that's what really can lead to the skin cancer later on.
But in terms of people from different nationalities, different skin types, jobs, I mean, who is more likely than the other person or the average person to have an issue? That's
a really good question because a lot of my African-American patients, a lot of my Latino patients come in and tell me, well, I don't think I need to wear sunscreen. I have darker skin. Our skin protects us from the sun. While that is true to a certain extent, we still can have harmful rays. The first patient I ever saw as a resident was a black female who had skin cancer. So it's important for everyone to use sunscreen.
We have a couple minutes left in the conversation with dermatologist Howard Brooks. Phone lines open for your questions. Do dial now, though, and we'll get your call right through at 703-387-1020. How often should people have a routine? I mean, do you recommend that people who don't see anything that causes them concern, is there any reason to go to a dermatologist just kind of as a routine, every now and again thing that you would do?
It depends on really your family history. If someone came to me and told me they have no moles in their body, then no, they probably wouldn't need to come in on a yearly basis. But if they do have a family history or history of sunburns, and I would recommend at least once a year. If you see something that's disturbing to you or a mole that hasn't been there in the past, a mole that's been there but changed or become symptomatic, then certainly bring it to a dermatologist's attention.
What kind of products did you bring in? It's kind of show and tell. You brought a couple things with you?
I brought a few things in here. This is one that's pretty interesting, and parents like this for their kids. I actually personally like it for myself. It's a spray suntan. You don't have to worry about rubbing the suntan in. Kids like it because they can spray, keep it in ice, and it makes you nice and cool when you're by the pool or near the beach. It's by Neutrogena. This is another one. They're really promoting this year. It's been all over not only the AAD conferences, but in every single magazine and television that I look at. It's protecting you against UVA as well as UVB.
Okay, and these have some pretty big numbers on it. I noticed that this one is 30, this one's 57, and the other one you brought is what?
The other one is a 55. Now these are all sunblocks used. I wouldn't recommend necessarily using these high numbers every single day, but
is there any reason not to?
There's no reason not to.
Okay.
There's no reason not to. As a matter of fact, several people use this brand because this is the one that's heavily promoted now every day, and that's the SPF 57, as you said.
But I think probably what happens is that as people get older and they know someone who's had something taken off,
Right.
it kind of raises the consciousness for all of us.
Right.
If we're getting to that point where we care more about avoiding problems than having that great tan, you just go with the bigger number, I'm guessing.
Well, you know, not necessarily. I think that you should maybe just use the SPF 15 or 30 every single day. Reserve these higher numbers if you're out in the sun a little bit longer, if you're going to the beach, if you're going to the pool.
And let's say we're going to the beach, we're spending time at the pool, we're in and out of the water. What's the rule on reapplying?
The rule on reapplying is reapply every 2 hours unless there is excess sweat. If you do go into the water or go into the ocean, then come back and not reapply at that time.
So 2 hours and potentially more often.
Potentially more often.
All right, good advice from dermatologist Dr. Howard Brooks. Thanks very much for your time. We'll visit with you again.
Thank you.
We appreciate it. We will step aside here for just a moment. We'll talk about Monday's edition of News Talk in just a moment. And Beverly Kirk has a look at what's cooking on Live Tonight.